Hi everyone, my name's Nathan. I'm with Bladen Community College, and today I wanted to talk to you about a subject that's close to my heart. It's physician-assisted death, called the Death with Dignity movement. So whether we like it or not, we all have to face our death at some point. Whether we're young or old, sick or well, it's something that we all come to terms with at some point in life, and it's something that terminally ill people are having to think about constantly. As a paramedic, I'm often transporting these people who are dealing with the symptoms of their terminal illness, and they know that they're unable to change anything, and they're often suffering with what they're going through. Because of this, we have the Death with Dignity movement, which seeks to allow people to end their lives on their terms whenever they want to. My goal here today is to show you that physician-assisted death is morally acceptable, and that it should be a basic human right of those who have a terminal illness. So death by location. First, looking at the problem, we can see, according to John Cloud, who published A Kindler, Gentler Death in Time magazine, 7 out of 10 Americans would prefer to die at home. But more than 80% of these living with chronic diseases die in the hospital or the ICU setting. Half of all Americans and 20% die in nursing home and long-term care facilities, making over 70% of people dying in somewhere other than their own home as they would like to. The cost of dying is enormous. According to B. Zhang and Associates, who published an article, the cost of terminal illness accounts for 32% of all Medicare spending, which affects everyone, whether you're dealing with a terminal illness or just living in this country. Terminal cancer patients spent 33% less on medical expenses when they had end-of-life discussions with their family and their physicians. Pain and discomfort. These people are often dealing with pain and discomfort. Over 90% of terminally ill people experience pain every day in the final 6 weeks of life. According to J.N. Morris, who published an article in the Journal of Chronic Diseases in '86, 70% of terminally ill patients experience shortness of breath in their final 6 weeks, and 80% experience fatigue in the last 6 weeks. Our duty is to help those who are being burdened, and one of the ways we can do that is by changing the ways that we look at terminal illness in the end-of-life discussions. So terminally ill people have been interviewed before, and according to M.P. Lawton, who published an article called The Quality of Life in the Last Year of Life in Older Persons in 1990, he discovered that 4 types of psychological well-being are sought by those who are living with a terminal illness. Those are emotional well-being, dignity and self-esteem, a sense of autonomy and control, and resilience. Whenever people are suffering with a terminal illness, they often lose their emotional well-being. The current stigma and laws regarding physician-assisted death can weigh a heavy toll on them whenever they know that they're going to be dying anyway. They also experience depression and stress knowing that they can't change anything in the nature of their illness. Dignity and self-esteem, the inability to shower, wash themselves, eat and drink. They also fear being pitied and don't want to be pitied. And they're forced to rely on others to help them in their daily activities. Lastly, the sense of control and autonomy. The inability to care for themselves and the loss of function in their body can get rid of that sense of autonomy and their dignity. So the Death with Dignity movement tries to help these people suffering from a terminal illness choose the timing of their death, and for those who want to seek a gentler death, and reduce the suffering by helping not only end their life on their terms, but to protect their emotional well-being. The process for Death with Dignity first starts with you being checked out by your doctor, confirming that you have a terminal illness. You must be over 18 years old, and you must have a thorough psychological evaluation to determine that you're not being coerced in any way by family members or friends or anyone surrounding you. The next steps, they'll notify next of kin so family is aware of what's going on. You'll next be prescribed a prescription of a barbiturate. It's either going to be phenobarbital or secobarbital. You have a choice of whenever you take it. You'll be prescribed a pill, and you can decide if you ever want to use it. If you don't want to, then you can throw it away and discard of it. Whenever you take the pill, about within 1 hour, you just fall asleep and you experience a very gentle, kind death. The benefits of this physician-assisted suicide is that it maintains the psychological well-being. As we mentioned, these people are suffering in multiple different ways, and it saves themselves and their families from debt. In terms of maintaining psychological well-being, it maintains their dignity, autonomy, and reduces depression. It shortens the amount of time experiencing the worst symptoms, such as the pain, fatigue, and shortness of breath that we discussed earlier. And it ends their life before the disease progresses to a point where they can no longer care for themselves and require caretakers. It also reduces debt and suffering. According to E.J. Emanuel, in 1998, published in the New England Journal of Medicine, it saves each patient a minimum of $15,000. That's the average cost just incurred in the last 4 weeks of life. Not even being said the cost over the last 4 weeks. It spares the family of seeing a loved one suffer, And it also has the ability so families can see their loved ones choose a gentler death before any of these things start to affect them. So as we've discussed, there is a problem with terminally ill people not having a way to go about any other way than dealing with the symptoms until it causes a more gruesome death. I hope that I've been able to argue and show you that it's morally acceptable and should be a basic right of the terminally ill. And it allows a person to maintain their psychological well-being, which is the most important part. Lastly, I want you to think about this. Although we might have trouble with this morally looking at ourselves, unless you're dealing with a terminal illness, we really need to be thinking about what they're going through and what they would most be wanting right now. Thank you.